Hi, I'm Gina, and I'm here today to follow up on a pledge with one of my colleagues who made a pledge during last year's Disability History Month. Can you please introduce yourself and tell me what your role is?
Thank you, Gina. Yes, I can. So my name is Malaika Lynch. I'm a National Diversity and Inclusion Programme Manager here at Health Education England.
Thank you. I have one question for you, if that's okay, which is what work have you done this year to help create a disability positive NHS?
Thank you. So first off, I would just like to say I think it's really, really important that we are celebrating Disability History Month and that we are showcasing the work that we do in order to support our colleagues with disabilities, but also for that ripple effect into the system in the kind of day-to-day workings of HEE that helps us to have that ultimate impact of creating a more disability positive NHS. So here at HEE over the last 12 months, we have primarily focused on outcomes from our Workforce Disability Equality Standard report that we received last year. We have looked at areas where we could improve and areas that produced kind of the biggest discrepancies really in terms of experience of our colleagues with disabilities and those who do not have a disability. The outcome of that has been that we focused on three primary areas, one being data, so just increasing our declaration rates on ESR in order to ensure that we have a better picture of disability representation across the business. The second area was around inclusive recruitment, and that is an area where we find that our disabled colleagues say that they feel most disadvantaged, and the conversion rate from application through to interview through to appointment is not necessarily a positive one. So with this in mind, between ourselves in the Diversity, Inclusion and Participation team and our colleagues in the People and Culture team, we led on a project that looked to extricate bias from our recruitment processes. So we've overhauled our recruitment processes to make them more inclusive. And the final bit of focus that we've had in respect of this area has been around talent management. And that's really around being able to provide as much access and opportunity to our colleagues with disabilities across the business to be able to really flourish and be able to receive from us as an organization the learning needs and the access to all of the different kind of development that they might wish to have in order to be able to progress either within this organization or beyond in the wider NHS. Thank you.
Thank you. That's just amazing work and really great to hear.
Thank you so much for having me.